To our faculty and staff, I'd like to say thank you for all you're doing to help serve our patients, our community, and one another. This is an unusual time, and the situation with coronavirus is changing by the minute. I'd like to make sure you know what's going on and what our teams are doing to prepare. First, why are we working so hard to mitigate the spread of coronavirus? As we're seeing in China and Italy, when the virus goes unchecked, it overwhelms health systems. That's why we're making difficult decisions now to better control the spread of the virus later. While most people who contract the virus will only experience mild symptoms, we owe it to the most vulnerable in our community to protect them. Let's take a look at what's going on right now. Now let's look at COVID-19, where as of today, March 10th, 115,000 individuals worldwide have been found to have coronavirus. Right now, the mortality rate appears to be between 1% and 3%. Earlier on in the endemics, the rate was a little bit higher. More recently, the rate has been approaching 1% as healthcare professionals around the world get better at caring for this disease. Again, when we keep this 1% to 3% mortality rate in mind, there are many things that we deal with in clinical medicine where if we told patients they had a 98, 99% chance of doing perfectly fine, that would be encouraging. So while the mortality rate is quite a bit higher than seasonal flu, it is relatively small compared to a lot of things that we deal with at the academic medical center. Why all the focus on COVID-19 at the moment? And it has to do with the rate at which these infections arise in our community. These two curves show the difference between seasonal flu, for example, which comes on very slowly over many months, rises to a level where many individuals do get sick and some will pass away, and then over many months dissipates from our communities, typically in the spring. Some of the reasons for that is the flu's been around before. Many of us have immunity in our systems. Many of us take vaccines to prevent the flu, and we do have antivirals like Tamiflu, which helps keep flu in check. Coronavirus is a new pathogen to human beings, so we do not have immunity, we do not have vaccines, and we do not have antivirals that are known to impact diseases caused by COVID-19. And typical control measures include hand washing, teleworking, limiting large gatherings, and minimizing travel. So again, the goal is to help reshape the transmission of disease in our community from the tsunami to the slower, more steady, lower wave so that our healthcare system can take care of patients and not be overwhelmed. These are the groups that are currently working on coronavirus at the University of Utah Health, the University of Utah, and in the state of Utah. Governor Herbert's task force is convened. Dr. Brian Shiozawa, a member of our faculty, is a member of that task force. President Watkins' response task force meets daily at 7:45 a.m. and guides the university's emergency response. The campus emergency management group, and specifically their situation triage and assessment team, the infectious disease group, meets twice a week to coordinate our campus efforts. And the university hospitals and clinics has assembled CELT, the Coronavirus Executive Leadership Team, which also meets twice a week, and in fact has 12 subcommittees that make up our Code Bio response team. Just as we have a mass casualty plan prepared, we do have a Code Bio team, a Code Bio plan that is now being implemented by our Code Bio team. These are just some of the groups that are dealing with ambulatory care, communication, education, security, supply chain, and so on. Probably one of the first things that you saw is in an effort to increase our capacity and to increase our ability to separate patients with respiratory illness from those with other illnesses. We assembled 3 large tents out behind the emergency room. These tents are areas where we can care for patients. They have controlled air systems, and we can help, one, add capacity to our emergency room, but also provide separation of patients who are experiencing respiratory illnesses. Please know we're prioritizing the safety and protection of our staff and our patients. We're doing routine trainings and education to make sure everyone is aware of the most up-to-date information. We're also making sure we have the supplies we need to keep you safe and to serve the community should an outbreak occur. We're updating Pulse daily with important information about our safety protocols, guidelines, and policy changes. Pulse is our clearinghouse for important information. So I ask you that everyone checks Pulse on a daily basis. We all need to work together, and I'm confident our ability to care for each other and for our community will continue. The community looks to us during challenging times like this, and I look to all of you for your expertise and your commitment. Thank you for all you do.